It is common ground, I hope, that we should care for our mentally ill, and also common ground that we rely on skilled, multidisciplinary teams to provide this care, and that those team members should be adequately resourced, remunerated and respected. This team includes psychiatrists employed in our public hospitals who care for our most vulnerable, psychiatrists employed in our forensic hospitals who care for those who present a danger to themselves and to others, staff psychiatrists who have been trying to talk to this government for over a year now. They have been asking for respect and for adequate remuneration to address existing retention issues. The retention issues which see over a third of staff positions filled by locums at 3 times the cost. Health can afford to pay these locums, but apparently cannot afford to engage in respectful wage negotiations. Psychiatrists have not been heard by this government. They warned that they would resign if they were not listened to, and this government's response? The Minister shared this with us yesterday. The contingency plans in place to cover her leave in January did not involve consultation, did not involve negotiation, did not involve listening. They were to redesign our mental health system to work without specialist psychiatrists. It is clear from his press conference that Premier Min struggles to tell the difference between psychiatrists and psychologists, let alone understand the real difference between the work that they do. Minister Jackson indicated that nurses, residents and registrars could work outside the scope of their existing duties, muck in and take on the work of consultant psychiatrists. This is tantamount to saying that more than half of the psychiatry positions in public health are redundant if other health workers can simply step up and fill these roles, and ignores the fact that our nurses, registrars and residents are already working to more than capacity and do not have either the training or the time to take on additional load. And have these contingency plans fixed anything? Not if you are a mother experiencing significant mental health problems in the perinatal period, because the excellent mother and baby unit at Westmead Hospital is now closed. Where do these women go? Who provides care for them? The care which will prevent intergenerational trauma for their children. This unit isn't fixed, it's closed. Or if you have an eating disorder, a disorder so severe that you need to be hospitalised, how are the contingency plans working for you? They are not. Because instead of being in the care of a specialist psychiatric team, at a number of hospitals you are being cared for by specialists in drugs and toxicology, which of course has a knock-on effect for patients who actually need this expertise. And as we heard, there are arrangements in place to shift public patients to private hospitals. At what cost to New South Wales Health? And with what impact on the availability of beds for private patients? It is amazing to think that this government has had time to talk to private health providers, has found money to pay them, but hasn't been able to engage in successful negotiations with our psychiatrists. Are they even trying? Do they value the specialist work done by these critically important medical workers? Can we say that we truly care for our mentally ill? And for those in crisis, for those with severe psychosis or suicidal ideation who make their way to our emergency departments, how are the contingency plans working for these people? They are not. We know that if they can bear the weight, they are facing waits of up to 4 days in emergency departments. But of course, on day 2 or day 3, you don't know how much longer you have to wait. How many more hours to refine your suicide plans? How many more days you have to live in a state of psychosis where you may not be able to trust what you see, what you hear, or anyone around you, where you may well be a danger to yourself and others, and where you are uncared for because this dispute has not been addressed promptly and appropriately. Our Minister for Mental Health aspires to be a political leader who steps up when others are stepping back. Do not step back from the mentally ill. Do not step back from those in great need. Step up to the table and negotiate respectfully with the psychiatrists. It is time to end the pain of the acutely mentally ill in New South Wales.